This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
In this video, I'm going to demonstrate the horizontal chop technique in an eye with a free-floating nucleus. Let's try to understand certain basic principles when you're trying to do this maneuver in a free-floating nucleus. Now, he is a 65-year-old gentleman who has this hypermature cataract. Patient is slightly sensitive to pain, and there's a reason why I'm giving a posterior subtenance anesthesia. 1.5% of lignocaine is injected in the subtenance space. The side ports are done. Trypan blue is injected into the antechamber under the air bubble. Usually I leave around 10 to 15 seconds for it to stain. In the meantime, I just bend my cystitome. BSS is used to irrigate out all the dye. The chamber is pressurized with dispersive OVD and time to perform the main incision. I prefer to stabilize the globe with some instrument. In this case, I'm using an aspiration cannula. The globe is turned slightly away from me. I make a vertical groove at the posterior limbus so that the conjunctival ballooning can be prevented. Then a 2.8mm blade is used to make the incision. The eyeball again is turned slightly away from me so that while I'm negotiating into the cornea, I can create corneal tunnel before entering into the eye. So as I puncture the capsule with the forceps, as expected, we have the liquefied cortex which is coming out. Since the visibility is not greatly affected, I continue with the rhexis, and I have a decent sized rhexis. It's about 4.5 to 5mm size. This should be sufficient. Time to emulsify the nucleus. Now obviously in this hypermature cataract, I don't prefer to do any hydrodissection. It's not required as well. So initially the phaco probe goes in and just aspirates all the loose cortex. And now is the time to start emulsification of the nucleus. The strategy which I usually follow is to do a small central trench which helps me to get access to the more central core of the nucleus so that I can grip it better. So the nucleus is again stabilized with my second instrument, that is the blunt chopper which I'm having it here. I'm just using it and trying to make a small central groove. The idea of this groove is to ensure that the phaco tip can be buried in the core or heart of the nucleus, so that I can get better purchase and hold, which is going to be very critical when I begin chopping. So I think I've reached around 50% or maybe 60% depth. This should be enough. So time to change the settings. I'm going to change it to the chop mode where I'm going to use just the longitudinal energy. As we can see, the torsional is 0 here. Time to chop. A short burst of energy is used. This is longitudinal energy to bury the entire tip into the substance of the nucleus. Then the nucleus is pulled towards me and lifted up. The chopper can go underneath the rhexis, hook the equator, and then the scoring of the nucleus is done. That is, chopper is moved towards the tip. The nucleus is rotated. The same principle is being followed. The chopper is placed exactly opposite, and then it is moves towards the phaco tip. And then there is a lateral separation maneuver which ensures that the posterior plate also is separated. As we can see, there is the one part of the posterior plate is still attached for both the fragments. So I'm going to hold the bigger heminucleus with my phaco probe and then do a little bit of lateral separation so that both of these two fragments get separated. Time to divide the second heminucleus. Again, the tip is buried until its entire length disappears into the nucleus. Chopper goes down, hooks the equator, and then comes towards the tip. And with multiple shallow lateral separation maneuvers, we can crack the posterior plate. So the maneuvers have to be very gentle here, as we are aware that the posterior capsule is directly exposed. There is no underlying cushion of the epinucleus. So our maneuvers with the lateral separation and the chopping maneuvers have to be reasonably gentle. There's absolutely no hurry to go in and do a lateral separation maneuver which is going to be very expansile. So again, I'm just stabilizing the nucleus. It takes a few more attempts to separate it, and if it doesn't separate, always we can lift up like this and just phaco the posterior plate. So what I'm doing is I'm just going towards the base of the posterior plate where it is attached, and I'm using just the torsional energy to cut that small attachment which was there. Now we have got the fragments separated from each other. Time to emulsify them. The settings are changed to the quadrant removal mode, wherein the torsional energy is the one which will be predominantly used, and the fragments are slowly but surely being emulsified. So again, as I repeatedly tell, that going slow really helps in minimizing the trauma to the endothelium. So I'm just trying to nibble at the fragment and go a little bit slow. You can look at the fragment, and both the nuclear fragments are in the capsular bag itself. So I don't want them to come and jump in the vicinity of the corneal endothelium. I'm trying to nibble at these fragments with them being in the capsular bag itself. So the posterior plane of emulsification is quite effective in minimizing the endothelial trauma and having a clear cornea first post-op day. So eventually all the fragments are emulsified. The bag looks to be quite clean with hardly any cortex there. So once the cortex is aspirated, time to implant the lens. The bag is inflated with OVD and the lens is maneuvered into the bag. OVD both in front and behind the lens is aspirated. The ports are hydrated, and that's it, the case is done. To summarize, when you're trying to do a horizontal chopping in a free-floating nucleus, such as this Morgagnian cataract, the most important aspect is to have a good grip. And to have a good grip, you need to ensure that the tip is buried totally into the substance of the nucleus. It might help to have a slightly longer tip, especially if you're dealing with a very dense cataract, and to have a very good hold and to reach the inner part of the nucleus. Doing a few small trenches so that we reach 50% of depth through the trench itself would be a good idea to ensure that the phaco tip is buried deep inside. And once you have got a good hold, the horizontal chopping is not so difficult at all. It's very physiological, and you just go in and hook the equator of the nucleus under direct visualization. And one tip to prevent any damage to the posterior capsule is to lift up the nucleus so that your chopper is still way above the presumed position of the posterior capsule. So in that way, you're relatively safer. So you're holding the nucleus, pulling it up a little bit, and then the chopper goes in, hooks the equator, and then pulls it towards you. So that was it. Thank you for watching and hope you found this helpful.